Ever feel like keeping up with medicine is like trying to catch a rocket? New drugs, treatments, it's a lot.
It really is.
But that's what we're diving into today. We're looking at becoming a specialist pharmacist, especially over in Europe, and using these RoleCatcher resources to, make sense of it all.
Definitely a booming field, and for good reason. We're not talking about your average pharmacy job here.
Right, this is specialized.
These pharmacists, they're crucial with how healthcare is changing, with their expertise.
And RoleCatcher seems to be the career platform now. They've got everything from like building your CV to getting ready for those scary interviews,
Oh, yeah.
even connecting directly with employers. Wild. But before we get into all that, let's back up. What even is a specialist pharmacist? Specifically in Europe, since that seems to be its own thing.
Okay, so imagine this. A pharmacist who's basically a walking, talking medication encyclopedia.
Okay.
Not just handing out pills, but they get the whole science behind them, like how they work in the body, how to use them for these really complex conditions. The industry trends section really stresses how important that's becoming.
So it's like pharmacy 2.0 or something. I mean, we know pharmacists are key, but this feels next level.
Definitely. And what makes it more interesting with Europe especially is the role can be totally different depending on the country.
Oh, right. There was something about the regulations, qualifications, all that varying.
Yeah, exactly.
So it's not just deciding, boom, specialist pharmacist, I'm there.
Nope, gotta do your homework, see what that specific country, its professional bodies all require. But the core of what they do, that's more universal.
Okay, so let's get into that. This what they do section, it uses some pretty high-level words.
It does.
Expert advice, monitoring drug therapy, even contributing to developing new drugs.
Yeah.
It's beyond just, like, reading a prescription, right?
Think of them like medication safety guardians,
Okay.
scrutinizing prescriptions, catching those interactions, contraindications, stuff a general doctor might miss. But also working one-on-one with patients, making sure they get their treatment plan, that they're taking meds right, especially for chronic conditions.
Which, let's be real, can be hard for people. Even I've stared at a pill bottle like, did I understand that right?
Exactly. That's where the specialist shines. Breaking down that jargon into plain English so patients are informed, empowered to handle their own health, and they're right there on the edge of new drug stuff, too.
The what they do section even mentioned, like contributing to clinical trials, research, that's wild.
It is. They're not just using the knowledge, they're making it. And what's really something is they're doing all this while handling all these different people, doctors, nurses, patients, researchers, the whole gamut.
Okay, so that makes those crazy high percentages for active listening, reading comprehension in that function section make way more sense. Because you don't hear pharmacist and think communication guru.
Right. It's easy to miss those soft skills when you picture like hardcore science stuff. But if we look at that with the work environment stuff, clearly talking to people is huge E for a specialist. Explaining things simply to patients, working with other pros, even presenting research.
It's not just what you know, it's how you say it. Getting it across so it sticks with whoever they're talking to. Clinical pharmacist, that's got to be where the real specialist stuff kicks in, right?
Yeah.
What's the day-to-day even look like there?
So as a clinical pharmacist, you're way more hands-on with patient care, often working right in hospitals or clinics. You're part of the team, with doctors, nurses, all that, designing and fine-tuning those medication therapies, especially for patients with the more complex situations.
So less about actually handing out the meds, more about using what you know to make the treatment fit the person.
Exactly. It's seeing the whole picture, their history, lifestyle, what drugs might clash, and making sure that plan is as safe, as effective as possible. The career stages thing, it even points out how clinical pharmacists, they might specialize even further, like focusing on just oncology or pediatrics, infectious diseases.
Wow, so you're not just clinical, you're clinical oncology pharmacist, working specifically with cancer patients. That focus must come with a whole different level of, I don't know, a challenge, but reward too.
It does. You become the person for that thing, which is exciting, but it means you got to be on top of all the latest research, treatment protocols, and of course you're working with people facing some really tough stuff, so that emotional side of the job, it's even bigger.
Yeah, the stakes are higher when you put it that way. It's not just managing a condition anymore. It's maybe giving someone a better life during a really hard time.
Exactly. And that's why all that active listening, empathy, explaining things, clearly it's not just extra, it's essential at that level. Because you're not just dealing with pills, you're supporting people, families through some heavy stuff.
Sounds incredibly rewarding, but yeah, I can see the emotional toll that could take. So say you've put in the time, got the skills, specialized, maybe worked a few years in a clinical setting. What's the next rung on this specialist ladder?
From there, you might become the specialist pharmacist. More responsibility, taking the lead in your area. Maybe you head up a team of pharmacists. Maybe you're publishing research or even shaping healthcare policies.
Less direct patient care, more using what you know to affect the whole system.
Kind of, yeah. The career stages section, it highlights how a specialist might be making those medication protocols for entire hospitals, health systems even, or running clinical trials, teaching other healthcare folks. Your knowledge, it's going broader.
And for those who are really into leading, managing, there's clinical pharmacy manager. What's that like?
Think of it as the boss role, but for pharmacy. Overseeing whole departments, budgets, new tech, making sure everything's high quality, safe. Big stuff.
So not only do you need the brains, but the management, people skills too. That's a lot to juggle.
It is, and it shows you how many paths this career has. You can make it your own, whether you love that direct patient interaction, the research, or being the one in charge.
And speaking of skills, we got to mention those certifications. The advancing your career bit talked about a few, like the BCPS, which, correct me if I'm wrong, is Board Certified Pharmacotherapy Specialist.
Nailed it. The BCPS, it's a big deal for pharmacists who are all about pharmacotherapy, basically using meds to treat illnesses. Shows you're an expert dedicated to the field.
So it's like, in a tough job market, it helps you stand out, shows you went above and beyond what's required.
Totally. Like a seal of approval from the pros.
Yeah.
And there are others depending on what you're into, like the BCACP. That's more for ambulatory care.
Okay, so you've done the work, got the qualifications, maybe even some fancy certifications. Now for the scary part, landing the actual job, which these days means dealing with online applications, right?
And those applications, more and more, it's AI looking at them first.
Right. That whole beat the automated recruiter info from RoleCatcher, that was wild. Feels like a movie, you know, algorithms deciding your fate. How do you even stand out to a computer?
It's a good question, and something everyone looking for work should be thinking about. These AI systems are looking for very specific words, skills, experience, stuff that matches what's in the job description.
So we've covered how this impacts individual patients. But zooming out, what about specialist pharmacists and a healthier society overall? How's that all connect?
It's not just, like, here's the right pill, bye. It's way bigger. Take healthcare costs. Those are nuts, right? Well, these pharmacists, they're key to making sure meds are used right, effectively, which over time, that helps keep costs down.
Makes sense. No use prescribing something expensive if it's not being taken right, or if there's a cheaper option that works just as well.
Exactly. They're also big on medication adherence, which, fancy word, just means making sure people take their meds as prescribed. Sounds basic, but for public health, especially with chronic stuff, it's huge.
Yeah, I see that. Because if someone's not doing that, it's not just them, it hurts.
Yeah,
Leads to bigger issues later, strains the whole system.
totally. And don't forget, public health campaigns, they're in on that too. Vaccinations, teaching people about meds being safe, even pushing for policies so everyone can afford their meds.
So it's like they're advocates
Yeah,
for the individual and on a bigger scale, for everyone.
spot on. They're that bridge between the hardcore science of pharmaceuticals and what the healthcare systems actually need day to day.
It's kind of mind-blowing, you know, this career path that's often behind the counter. It ends up touching so much.
It really does. For someone who's into science, who cares about healthcare, who wants to make things better, it's got tons of potential.
And for anyone listening thinking, that's me, that's totally me, RoleCatcher seems like the place to figure it all out. They've got everything, seriously, the AI resume stuff, interview prep, even putting you right in front of employers.
It shows how much things have changed. You got to have the right tools, the info, to even have a shot these days.
It's like your own career coach plus a tech expert, all in one. So yeah, if today got you inspired, go check out RoleCatcher. See how they can, help you actually make it happen.
Never too early, never too late to start looking at your options, taking charge, all that.
Well said. And on that note, we're wrapping up this specialist pharmacist deep dive. Definitely challenging, but man, the rewards, the impact you can have, that's something special.
I'll say, really enjoyed digging into this with you.
Me too. And to everyone listening, thanks for being here. Keep those questions coming. We'll keep bringing you the knowledge you need to handle whatever this crazy world throws at us. Until next time.